Well, it's basically a project that tries to capture a lot of information about our patients. It analyzes millions of records every second, and it captures this information from several information systems in the hospital. And it tries to find risk patterns in specific clinical areas, so it can detect and predict if the patient is going to have a problem in areas such as the clinical deterioration risk, infection control, and also in terms of misuse of antibiotics. So we try to fire alarms using big data, analyzing this information quickly, and alerting our physicians and nurses for problems that the data might already be revealing. Well, from an IT perspective, one of the challenges is try to collect information from different systems that come from different vendors. So you need to be a little bit resilient on this and push the vendors to share the data with us. From a human perspective, what we found challenging is getting the physicians buy-in. So you need to get them into the process. They need to be part of the team and not only be the end user. They need to help you develop the solution, because otherwise it won't work, it won't solve their problems. They need to be part of the team. I think it's the most important advice I can give to my colleagues. Yes, one of them is that we are, for instance, in the infection control area, we are isolating patients a lot faster than we were before this solution, because our infection control team can know about the patients which are infected with multi-drug resistant bacteria in advance. As soon as the lab gets that data into the database, we have a bunch of algorithms that analyze this data and fire alerts to isolate that patient immediately. And also in the antibiotics misuse area, we can now control all the hospital what are the patients taking in terms of antibiotic therapy, and fire alarms if the antibiotic course is not adequate for that kind of patient. So we empowered our stewardship team with data, and they can act daily on our several departments and change the behaviors, which obviously contributes to reducing infections and better use of antibiotics. And finally, we also have in the clinical risk area, we can predict in advance some serious situations of risk, and fire alerts also about hemodynamic instability, infection problems. Just looking at the movie, just looking at how that patient data is evolving and finding patterns on it that are worrying patterns. Well, sometimes they don't know where that data is coming in, but I honestly don't think that's important. Sometimes they receive these alerts, they see them, they act upon them, but they don't know if this is a big data system or if this is a fancy algorithm. Honestly, that doesn't matter. What matters is delivering the right data to the right person at the right time. And you need to do it in a simple way. Maybe a text message in the mobile phone, maybe an alert in the EMR. It doesn't matter. It doesn't matter the kind of algorithms we have behind it. It just matters that you deliver that information and that you can change effectively the medical practice.